Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Reye Syndrome. Introduction. Reye syndrome, also known as Reye syndrome, is a rare but serious illness. It can cause swelling in the liver and brain. It usually happens in kids and adolescents. You can save someone's life by getting Reye syndrome diagnosed and treated early. Seizures, confusion, or loss of consciousness need to be treated immediately. This program explains Reye syndrome. It discusses symptoms, causes, treatment, and prevention. Reye syndrome. Reye syndrome can affect the blood, liver, and brain of a person who recently had a viral infection. Reye syndrome always follows another illness. Reye syndrome may happen after an upper respiratory infection such as a cold, chickenpox, the flu, also known as influenza. It usually happens in kids and adolescents. People who have metabolic disorders are at a greater risk. Reye syndrome causes a person's blood sugar level to drop. The person may develop swelling of the liver. Deposits of fat can also develop in the liver. Swelling may also happen in the brain. This can cause seizures, convulsions, or loss of consciousness. Most people recover in a few weeks without permanent issues after prompt diagnosis and treatment. Without treatment, brain and liver damage can happen. The person may die as a result. Symptoms. The signs and symptoms of Reye syndrome often appear about 3 to 5 days after a viral infection. Early symptoms of Reye syndrome are fast breathing, nausea, vomiting and diarrhea, sleepiness or no energy. Dangerous signs and symptoms can develop as Reye syndrome progresses. These may include confusion or hallucinations, loss of consciousness, seizures and coma, tiredness, violent or irrational behavior, weakness or paralysis in the limbs. These symptoms require emergency treatment. You can save the life of the child by getting Reye syndrome treated early. If you think that your child has Reye syndrome, it is important to act quickly.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. The cause of Reye syndrome is not known, but studies have shown that taking aspirin increases the risk of getting Reye syndrome. Reye syndrome may be triggered by using aspirin to treat a viral infection. Examples of these infections are chickenpox or the flu. Children over the age of 2 can take aspirin, but children and teenagers who are recovering from chickenpox, any viral infection, or the flu should never take it. Healthcare providers recommend other pain relievers for young patients. Reye syndrome happens most often in children and teenagers who have a fatty acid oxidation disorder. These disorders are a group of inherited metabolic disorders. They cause the body to be unable to break down fatty acids. Your healthcare provider can find out if your child has a fatty acid oxidation disorder with a screening test. Exposure to certain toxins may also contribute to Reye syndrome. These toxins include herbicides, insecticides, paint thinner. Reye syndrome is not contagious. This means that it can't spread from person to person. Diagnosis. There is no one test for Reye syndrome. Instead, screening for Reye syndrome often begins with blood and urine tests. Tests are also done for fatty acid oxidation disorders and other metabolic disorders. Your healthcare provider will do a physical exam. He or she will ask questions about symptoms, recent aspirin use, and past health problems. Sometimes more tests are needed. Your healthcare provider may need to check for other causes of liver problems. He or she may look for neurological problems. Other tests that may be done are spinal tap, also known as a lumbar puncture, liver biopsy, CT scan or MRI, skin biopsy. A spinal tap can help the healthcare provider identify or rule out other diseases with similar signs and symptoms. Similar conditions include meningitis and encephalitis. A small sample of CSF, or cerebrospinal fluid, is removed through a needle placed in the low back. The sample is sent to a lab for analysis. A liver biopsy can also help identify or rule out other conditions that may affect the liver. A needle will enter the liver through the skin on the upper right side of the abdomen. A tissue sample will be taken. The sample is sent to a lab for analysis. A head CT or MRI scan can identify or rule out other causes of behavior changes or decreased alertness. A CT scan uses an imaging machine linked to a computer. It creates detailed images of the brain. An MRI uses a powerful magnet and radio waves to generate images of the brain. A skin biopsy may be needed to test for fatty acid oxidation disorders or metabolic disorders. During a skin biopsy, a healthcare provider takes a small skin sample for analysis in a lab. Treatment. Most kids and teens survive Reye syndrome, but permanent brain damage is possible. Reye syndrome can cause death in a few days if not diagnosed and treated appropriately. Reye syndrome is treated in a healthcare facility. Sometimes treatment in the intensive care unit is needed. Healthcare providers will closely watch blood pressure and other vital signs. Treatment may include breathing assistance with a ventilator, diuretics, intravenous fluids, medicines to prevent seizures, medicines to prevent bleeding. Cooling blankets help reduce fever. These may be used to keep the patient's body temperature at a safe level. Prevention. The most important step you can take to prevent Reye syndrome is to not give aspirin to anyone younger than age 20. This includes any product that contains aspirin. Always check with a healthcare provider first. Children and teenagers recovering from chickenpox, viral infections, or flu-like symptoms should never take aspirin. This includes plain aspirin and medicines that contain aspirin. Before you give your child any medicine, including over-the-counter and herbal products, always read the label. Aspirin can be found in unexpected medications such as Alka-Seltzer. Other names for aspirin you may see include acetyl-salicylic acid, acetyl-salicylate, salicylic acid, salicylate. Use other medicines to reduce high fever or relieve pain if your child has the flu, chickenpox, or another viral illness. Other medicines you may use are acetaminophen, ibuprofen, naproxen. Some healthcare facilities screen newborns for fatty acid oxidation disorders. Because the risk of Reye syndrome is greater for children who have fatty acid oxidation disorders, these children must avoid products with aspirin in them. Children and teenagers who have certain chronic diseases may need long-term treatment with drugs that contain aspirin. This is called aspirin therapy. Before your child takes aspirin, always make sure he or she is up to date on the required vaccines. Your child should receive 2 doses of the varicella vaccine for chickenpox and a yearly flu vaccine. This can help prevent Reye syndrome.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Reye syndrome can damage the blood, liver, and brain of a person who recently had a viral infection. It always follows another illness. Reye syndrome usually happens in kids and adolescents. People who have metabolic disorders are at a greater risk. The cause of Reye syndrome is not known, but studies have shown that taking aspirin increases the risk of getting Reye syndrome. Reye syndrome may be triggered by using aspirin to treat a viral infection. Examples of these infections are chickenpox or the flu. Most children and teenagers do not die as a result of Reye syndrome, but permanent brain damage is possible. Reye syndrome can cause death in a few days if not diagnosed and treated appropriately.
Thank you for using Explain.